Most patients, when they arrive here, they've been previously treated only for their inability to ovulate, as this is the most obvious symptom. And they use well-known medications such as Clomid or Femara. Some even move on to in vitro fertilization. As many are successful with just these treatments, most centers will continue to repeat the same treatments over and over again, despite a complete failure or recurrent pregnancy loss. It is these failures that eventually end up at my practice. The main component in PCOS is insulin resistance. The inability for insulin to carry out its job of moving glucose or sugar out of the bloodstream. This resistance is due to a defect in the receptor that insulin must bind to in order to carry out its functions, and the failure of insulin to work correctly causes the body to make more insulin. It's these increased levels of insulin that starts a cascade of issues that interfere with quality egg development. In fact, it's insulin that pushes many of the most early primordial follicles into the antral follicle stage, and this is what gives the classic appearance of a polycystic ovary. The insulin also interferes with the mitotic division of the egg, and many times the egg that's created does not fertilize correctly, leading to failed cycles or miscarriages. Insulin binding to the follicles also raises LH production, and that in itself can affect egg quality. The elevated insulin levels also force the deposition of fat molecules into adipose cells. These are fat-storing cells. And as they fill, they burst, and this causes the release and the production of very potent inflammatory chemicals, one of which is called TNF, or tumor necrosis factor. It is these inflammatory chemicals that stimulate immune cells to essentially attack an invading embryo, leading to failure to conceive or even miscarriages. Lastly, these same elevated TNF levels are also known to activate another system in the body called the complement system. And when activated, the breakdown in these complement proteins increases the risk of thrombosis or blood clotting. And if it's unchecked, it can essentially clot off the blood supply of the invading embryo, again leading to miscarriage. Sometimes our PCOS patients come to our clinic and they have a history of multiple failed cycles of in vitro fertilization. Many times the only problem that we find is that the cycles were triggered and therefore ended early because of the fear of ovarian hyperstimulation syndrome. When we correct these stimulation issues here, we consistently and safely yield a higher number of good quality embryos, and again we lower the incidence of failed cycles or early miscarriages. PCOS patients have a wide variation in how they present to our practice. In some, there's what's considered the classic presentation of the patient who is heavier, has excessive hair growth, and fails to ovulate regularly, with multiple chemical abnormalities. And on the other side is the patient who may be thin and whose only finding are ovaries that are consistent with PCOS. But what we're finding is that treatment may be required in this full range of patients. So it's important to diagnose and treat all of the problems that are found with PCOS. And it's also important to investigate and treat the entirety of the syndrome. Well, this is what gives us the most expertise in treating a syndrome as complex as PCOS. Because of our background in immunology, we're able to treat all of the components and give our patients the best chance for success, whether they're performing insemination cycles or whether they're performing in vitro fertilization.